We'll continue to discuss about Wen Bing, and this is number 3rd part of the slides presented in the blackboard. And this will focus on more about specific etiologies, pathologies. Some of that information has been repeated or overlap a little bit. So basically, for winged worms, and we're talking about winged heat pathogen, obviously. Summer heat worms will be related with summer heat pathogen, and damp worms will be usually related with damp heat pathogen, and autumn dry worms related with dry heat pathogens. And warm toxic is warm toxic pathogens, because all fever dominated. So you can see, besides the first term, second terms always involved with the heat. For the last pathogens here and warm toxins, both will indicate that the heat, more severe heat as well. Now, these slides indicate specific changes, and from the wind heat pathogen can causing windworms disease. So wind heat attacks the lung channels or lung systems or wheel levels usually first, because this is a frontier of the body as a wheel level. And wind heat easily transformed from fire and damage the body yin, because they are warm in nature. That's the reason. And heat has very strong penetration abilities, and especially very easy to damage very tender, gentle lung, and easy affected stomach's yin. So that's why. And disease is very easy to be transmitted due to heat pathogens, and so they comes very quick and also changes very quick. So either they become very well managed by using specific interferences, or it's going to be progressive and affect internally pericardium or other organs. Summer heat causes summer heat worms, so which is very easy for us understanding of the diagnosis foundation pathology study. Summer heat attacked which part of body? Stomach straight away, because all the portals are open in the summer, and most of the pathogens involved for the body in summer is through the eating and the drinking or contaminations of any kind of food. This kind of summer heat affect the stomach very easily, result in nausea, vomiting, food poisoning, and spleen will be correlated to be suffering at the same times. Especially if you have pre-existing weak spleen, any kind of effect by the stomachs in summer will affect the spleen and stomach both simultaneously. Summer heat also can attack pericardium due to the nature of summer is fire. Pericardium also governed by element of fire. Fire attach element to each other and causing very bad unconsciousness and convulsion, emotional disturbing. Summer heat commonly injure body fluid due to nature of a fire and heat, and also can specific injury or damage resources qi. Because in the summer, if you can do experiment, if you want to do experiment yourself, you can stand under sun. Have a look how long you can last. One is you feel burning on the skin. At the same time, you feel so hot, and then you feel dizzy on your head, serious dehydrations. So your original source of qi is going very easy to be scattered due to heatness damages of the bodies. All the pores of the skin will be open at the same time. Damp heat causes damp worms. So damp heat will result in damp worms illness. So damp heat develops slowly due to the nature of dampness. Dampness is in nature. When combined with heat, it depends on the percentage of dominations. If damp dominated, it goes very slow. If heat dominated, it goes a little bit faster. But overall, as a damp heat combination, both yin and yang combination causing this pathogen damp heat, and compared with other simple wind heat, the progression is relatively slower and can have a bit longer duration of suffering result as well. Damp affect the Middle Earth straight away, as a kind of nature of the damp attached to the Middle Earth. Pathogenic dampness can easily block rising of clear yang qi, resulting in dizziness, and also obstruct the qi dynamics for people, especially have pre-existing middle jiao weakness, and also can constrain liver qi, causing some discomfort or pain or distension at the same time. Damp is horrible pathogens in general, and like this kind of like winter in Australia. Australia do not have very cold temperature in winter because the dampness present in winter make people feel much more cold, because damp is more yin in nature, combined with coldness, double yin in nature, will further constrain the qi flowing and restrict energy qi circulations, make you feel so cold. Dampness and heat combination is difficult to treat because damp is very, very yin in nature. They do not like mobility, they do not like leave, they enjoy the stay in the spots which they located. Dry heat were causing autumn dryness illness in Wenbing, and autumn dryness is quite a common presented in autumn season. The lung is a specific organ and dominant their qi in autumn, so very easy to be affected. And also lung prefer warm and moist environment. If it's so dry, lung functions will be affected. So in general, if you try avoiding any kind of influenza, common cold, upper respiratory systems infections, keep your throat moist, keep your nose moist, rehydrated. This upper respiratory system can minimize this kind of unnecessary virus affect you in a way. And dryness, easily consuming body fluid, especially in the lung, can cause dried cough and dried mouth and very bad whooping coughs. How would you keep your nose moist? Inhale the steam from your teacups and regularly drinking liquid, your nose will be very well moist. Thank you. It's a good question. I remember in the stage when I was breathing through the oxygen tank, because frequent oxygen airs go through your nasal passage can cause severe dryness in the lining of your nose. So what doctor recommends you put some specific lotions made from sesame oils, sesame seeds, so using as a lubrication. Any kind of other Vaseline related moisturizer cannot be used for the nose because they have harm for the lung organ. But the sesame seeds or sesame oil extract from sesame seeds, which is a very, very safe and gentle one, apply for moisture nose. So in general, if you're not inhale any oxygen from oxygen tanks, if you only inhale air in the free spirit, you can inhale some steam, vapor from the tea, from hot water or soup. Thank you. Now, epidemic qi and warm toxins. So Li Qi is very contagious epidemic pathogens, and Wen is very warming toxins. So these two etiologies are none of that very friendly. They all can cause horrible suffering for the clients. Epidemic qi, Li Qi, can cause spread around the population suffering the same illness, but warm toxins not necessary if you don't have directly and close contact with the discharges. In general, they're all virulent, contagious, and infectious, and occurring suddenly, progressive, rapidly, and deadly. Li Qi can go through the respiratory systems, but Wen is from the physical contact. And number third, they have warm toxic manifestations, can be confined to certain areas. And number four, they also spread throughout the entire body, interior and exterior, and affect the qi and blood level easily. And I don't know if any of you had very serious warm toxin, very serious wound, very serious infections, soft tissue infections suffering. I had when I was in one study, university study, I used some chemical products trying to minimize body odors, and it had very bad allergies, causing horrible infections under the armpit. You can feel the lumps as big as a table tennis ball. It's huge, so painful. Even affect the nerve systems. You couldn't even move your fingers. So you can imagine the severe of this very bad infection. Went to the hospital. They cut it off and drained the pus out, as a lot of pus built up from inside, and temperatures also relieved after pus come out from the horrible infections. It's very, very bad one. And it's good experience in a way. So don't use any unnecessary products if you're not familiar with, especially if they don't have very good reputations. And sesame oils prevent epidemic. I mentioned sesame oil is a very safe one used for nasal passage because they have no damage for the lung. When I was breathing through the oxygen tanks, which causing serious dehydration for my nose, so doctor gave me some ointment which is made from sesame seeds, and I can put it in my nose. So sesame oil is not used for preventing any epidemic illness. But sesame oil can use for burn, and sesame oil can change and alter the environment of pH, and in some way can help you mentally to avoid it. But if you say sesame oils can help you to deal with COVID-19, it's a big risk you can take. Any kind of ancient record, they have some things involved with some epidemic at that moment. But if something is new, you don't know, you can always have a try. Are they work or not? It depends. You can have some experiment. So I don't know it's a correct or incorrect answer for that part. Thank you. Like a lot of Chinese herbs has been used to treating the COVID-19 patient in China, get good successful clinical curing. Are they going to alter the blood test or not, which has not had sufficient data to show that yet. So because TCM is completely different modality compared with the Western medicines. So there's just two complete different modality, and they try to adopt each other or try to prove some way using conventional research. So which is very hard to find a common ground in a way, unless you're using Chinese herbs as a pharmaceutical form. Chinese herbs can be used as pharmaceutical form, use very heavy dosage to try to match with the conventional doctor required, or you can use as a energetic form, use very gentle, simple form, or combination both, depends on constitution of clients. Now, this slide trying to present it epidemic Qi and worm toxins regarding to the specific other natures. So worm pathogen disease and worm epidemic illness, and these are all very contagious conditions. The different things here for the Wen Yi epidemic one, like a SARS, bird flu, or the COVID-19, high temperature related syndromes or strain related conditions. And this is horribly can causing very big population sufferings. But the warm pathogen disease and warm toxic one usually more localized in local regions. They do not causing huge population suffering around the world, only localized one. So like in whole kindergarten, maybe 50% of kids had mumps because the kids love to sharing things to each other. Yes, but they don't cause the whole city, all the kids have the mumps. They don't. But this is very bad. This is caused by rat. And this is a horrible one, kills a lot of populations in the time when this is happening. And this is very serious one. This make people sick. I hope nobody will suffer that anymore. And this fact of the influence of the outbreak of warm pathogens, there are so many factors. One is strength of pathogens. So the strength pathogens is not very bad, it's okay. So usually when the pathogens, they try to adapt to different group of populations, through the mutation, they can weaker and weaker, and eventually they can become part of the human beings or part of the animal kingdoms. They coexist together. So they are very, very gentle. And they adapt to be survived and instead to be eliminated. And also depends on the constitution of the Zheng Qi pathogenic factors. And also depends on the environment you live in. So we are lucky in the countries very, very lower dense of populations. So if you imagine you're living in India, living in some part of China, and there's very huge populations, whole accommodations, you can see whole buildings can live in over 1,000 people together. That'd be very, very scary. And also depends the changes in the weather. So Raining weather is good in a way to minimize respiratory suffering from virus conditions. Raining weather, because all this kind of humidity affect the transmissions of the virus in a way and affect the surviving environment for the virus in general. But cold weather is not good, can result in cluster populations and very easy for transmission. Warming weather, people can open the window, open the door, go outside, which can dilute it density of virus, usually have less chances contract the virus in the warming weather. And social and economic, we know that if you are living in a very better and economic built societies, you are very well looked after. Same for the policy from society. Now, I'm not talking about politics. For the time the Wuhan epidemic happening, I was in China. And you know, China had very strong policy and for a lot of things, but for the health maintenance of illness, they did great, wonderful work. That's why it has been criticized by the West. They say they have they don't have human right. They keep people in a cage. But because this policy, they isolated population, especially nursing home. They locked down nursing home straight away. Otherwise, all the people during this kind of epidemic, they are going to be suffering. Same like America. So Trump has did very, very bad work. He did not care about old people. He let people be free. That's why a huge number of population died from these horrible epidemics. Sorry, I shouldn't be political. It's not political. I'm just talking about human life, how to prevent epidemic in this kind of horrible suffering. Different government, different policy, different way to protect people. Now, pathway of transmission for Wenbing pathogens. So basically, skin and upper respiratory systems and stomachs are major pathway for this kind of transmission of Wenbing. So skin inhale, upper respiratory systems inhale from the air, droplet of salivas, people coughing, and from the nose and the mouth, upper respiratory, and skin from touch. And then you're going to scratch your eyes, your nose, rubbing your mouth, stomach from eating contaminated food. It can cause discomfort in the gut. So these are three major basic things, basic pathway can cause virus infections anyway. Now, any questions? This very simple, very common knowledge, should have no trouble to understanding. Let's have a look now, next part. Here comes next part about how the introductions about Wenbing. When people talking about Wenbing, and they're thinking about the Sanghanlun, because Sanghan is the first book has been discussed about Wenbing regarding the terms or some details, basic informations. So in the Sanghan, they are talking about any kind of external contact disease. Wenbing is a part of the Sanghan as well. Now, warm pathogen disease series has taken over more than 1,000 years to develop. And from the time of the book published in Sanghanlun or Sanghan Zabinglun is already discussed of Wenbing. But the details of the Wenbing series is much later developed and about the Qing dynasties later. So originally in the Wenbing, in the Sanghanlun, they have not have detailed discussions, specific and classification Wenbing's discussions, only talking about any kind of external pathogen involved. There could be cold, could be damp, could be heat, could be dryness, etc. And they do have a lot of formulas can deal with the Wenbing related conditions in the Sanghanlun, such as Chen Qi Tang families, and it's very famous. And by dominantly using Da Huang, deal with heat in the Yangmingfu organs, and even Bai Hu Tang, and deals big four conditions for heat and qi levels. It's very popular formula, still used nowadays for Wenbing management. During the 14th centuries, Wang Andao, as well as 15th centuries, Wang Ji also have a great contributions on top of Sang Hanlun's discussion of Wenbing, developed part of the Wenbings, and specifically in the later Qing dynasties, so much more near eras about the now reasons, and the great development has been happening. Because around that era of Qing dynasty, there's such horrible epidemics happening around the Yangtze River in a much more warming climate. And instead of Han dynasty of Shang-Han theories happening, that is much more around the Yangtze River in a more cold and not such northern part of China. But when the epidemics happening in the southern part of China in Qing dynasties, so this kind of illness has been much better recognized. New formula has been constructed, a new way of understanding for the warm illness happening and progressions has been very well discussed. And this is very good. Basically, it's a kind of flow way to tell the development of the Wenbing in general. So in the Yellow Emperor's internal classics, they mentioned basic any kind of external contract disease, and it's covered everything, either cold, heat involved. Part of that involved the Wenbing as well. It's heat dominated. And in the simple questions, still internal classics, this mentioned about body attacked by the cold in winter can suffer warming pathogens disease in spring. This discuss part of the lurking pathogens or mention something about you can have illness suffered or pathogens attacked you in the one seasons ahead about when you suffering the conditions there. Like a herpes virus, you could have herpes virus affect you without any symptoms, but once your constitution getting weakening, either have cold sores or have shingles. And in the chapter of 33, discussing seasonal disease, they mention specific warming disease, pathogen disease, and has been discussed specifically, such as symptoms as fever, sweating, rapid pulses. These are typical heat-related or heat pathogen-related clinical manifestations involved. And later, they also mentioned some specific cold combination with dryness and can affect some conditions as well. So this is similar like the autumn dryness suffering. And congestion heat, 郁火, like latent pathogens about emotional things can cause illness. So that's why people say if you eat too much of a nuts, have too much of emotional congestion causing this kind of heat, you're going to have a cold sore. That is from congested heat. They're cold to represent part of the warm disease later on as well. If this kind of cold sore becomes so severe infected. I remember in 1970s, one of my neighbors' child had very, very bad cold sore because she does not like a scape has formed on her cheeks. What she do on her chin, what she do every time the scape build up forming, she just opened up and starts scratch because itchy, causing whole of her chin had very bad, horrible cross infections on top of cold sore, and had ended up they covered all these kind of regions with purple liquid using control the infections, and had very bad pus also comes through, become typical warm toxic heat instead. This is specific flow mentioned still in the simple questions mentioned about epidemic illness, and they mentioned a specific way how to prevent it, and what kind of epidemical contagious, discuss in details. We can have a read. And simple question chapter 72 also mentioned if you have very strong antipathic energy Qi, and what kind of clinical manifestations, what comes out when you have external attack. And later on, in the Shanghanen, not later on, in the Shanghanen here also you have specific formula, can be used to deal with Wenbing, such as I mentioned already, white type decoctions, 白虎汤, 陈气汤, as well as 栀子池汤. And here also deal with the late stage of warm disease, have yin deficiency as dominant, still have remaining heat in the bodies. We can use in 黄连, 阿胶汤, etc. Now, in the Jingui Yao Li, they also have a lot of warm disease-related conditions can be resolved. So we can, and some of that we already learn from internal classics. Some learn from different subjects you learn, like gynae or pediatrics, etc. And here is a specific timelines tells us specific theory developed for the Wenbing and to deal with epidemic illness. First discuss epidemic illness and the specific conditions happening in the during the Neijing's eras. So let's discuss illness and then keep going until the Qing dynasties later. So all these kind of epidemic illness involved, they find from the Shanghai and early mentioned probably go to Taiyang region as a frontier attack. But when the theory developed, find Wenbing, they find the front lines is not Taiyang division, instead of lung systems, or the nose, the mouth, and the skin. So this is changes from these kind of timelines and based on different eras. You can read through details, and I'll leave it for free for you because it's too small for me to see it. And same for this one, it's horrible small. And lurking pathogen concept, and it has been mentioned some part in the early stage in the Shanghan Zha Bing Lun, but has not have detailed discussion yet. The detailed discussions only comes out discussions in the Wenbings or in 1519 AD. They're talking details of lurking pathogens there. But nowadays we know it's a kind of the similar like shingles. If you know shingles or herpes virus, you know the hepatitis, you know the people suffering the what's that illness? Like hepatitis A, very easy have the B and C, very hard to completely clean the virus from the bodies. Lurking pathogens have lots of theories, has been discussed in the past, and all the detail of that has been a little bit expanded, getting much more hot popular in the last 10 years from modern discussions by exploring more and more Shanghan, more and more Wenbing discussion, more and more modern concept, antibody buildup in the body, lurking pathogens and red dots around the tips of the tongue and edge of the tongue were like lurking pathogens or something. Sometimes you had virus inside the body, but you don't have clinical symptoms. But when getting weaker, you find, something comes out. I have no contact with any illness in the recent time. And then when you're checking back at the diary, you find many years ago, you had worked with somebody clearly or using something specifically. That was the time you attract that virus. So this lurking pathogen comes out. Actually, lurking pathogens or the congestion heat, and these two, if you combine together, congestion heat has been also talking a lot about emotional congestion heat. That's why a lot of people do not have very near stage of emotional distress can be counted when they're suffering, trouble with the uterus for women. But when they're chasing back, they do have intensive, a lot of emotional trauma happened in a specific time of life journey, result abnormality function of uterus. That is called congestion heat or some liver dysfunction in the organs. So this is much bigger now. Now, Sun Simiao is a very famous TCM practitioner. A lot of Lenten articles has been discussed. A lot of classics issues. Maybe part of that also can discuss of Sun Simiao. It's a good one. In his book or his special contributions, Wei Rei Tang is very useful to deal with gentle windworms related Wenbing happening in the spring. And Xi Jiao Di Huang Tang, because the specific major ingredient has been banned, we're using buffalo horn, replace it, but still can be useful to manage abnormal bleeding caused by external wind toxic heat, cause of Wenbing illness suffering, as well as Zi Xu Dai. This is a very good specific pill used to deal with people suffering unconsciousness due to internal heat. So this specific formula created or formed, recorded by him, has been very beneficial to manage the Wenbing illness in different stages. From different era of China, from Song to Qing Yuan dynasty, there's also have a lot of very good practitioners, have great contributions. So I'm not going through detailed discussion. I have summaries later to present this part as well. Liu Wanshu is also a very good one, and he is become fire school. It's a kind of school that using cooling and cold herbs deal with heat conditions. And also this kind of the heating and the cold one, not just deal with high temperature involved, also deal with the congestion heat involved conditions as well. So that's why they're using lots of draining, purging, purgative formulas in the practice. Wang Andao, and he's a bit different. His point specific Wenbing should be not be confused with Sanghan in a way to emphasize different passages of warmth from the heat. Different practitioners have different angle to focus on how to understand original Sanghan as a kind of terms. Because based on different eras, Sanghan, some people translate Han as a cold, but Han actually is a pathogen which involved cold and heat. Wu Youke has become very famous to created specific book talking about discussion of worm epidemic, which is the first book to discuss epidemic disease in the whole world. Ye Tianshi also have a great contribution to created specific theory of the 4 levels to understanding worm disease in the Chinese medicines, and also further developed triple burner differentiations in his books. And he's very, very famous using very gentle, cooling aromatic herbs to vent the pathogens out to more superficial levels. So instead of using strong herbs like cooling schools, using purgative draining one, he prefers using gentle because he works around the Yangtze River. People living in the Yangtze River region, their constitution is different than people living in the Yellow River regions. They are more delicate. Xie Shenbai have great contribution about damp heat and presenting warm illness. His book is detailed analysis of damp heat, has been also published as well. He's very famous, have lots of relative formulas correlated in this book. And Wu Jutong also have great contribution for 3 gel differential diagnosis, specifically had very good details discussed for triple burners. When you become Wenbing specialist to do PhD or masters, you're going to have detailed discussion and research for all of them. Wang Mengying is also very famous in the one, have great contributions for all these areas. And he developed very good theories, overly cooling herbs used in early stage dealing with woman passages can result in troubled congestion. So in a way, and tells us early stage, if a problem early in the weed level, enhanced perspiration is vital instead of using very bitter cooling one to draining, which is causing further unnecessary leakage or lurking pathogens or congesting heat and trapped in the collateral and difficult to treat later on. That's why during the weeding in the gardens, if you do not remove root of the weed, weed will still be growing very happily, even very, very strongly when sufficient and sun ray or water provide for them. So in order completely to remove that kind of old weed, you have digging the weed root out as well as remove the vegetation growing on top of that. So that's the basic information we learned today. Let's have a look at the summary. I summarized it. I'll send it to you after class. So what we discussed today. So basic 7 points we have been discussed. One is assessment and the associated grades and due date. Just to remind you, if people miss that information, it's possible for the final exam will be keep running instead have 2 case study. So do not try to prepare the 2 case study. Maybe we're still going to set in the final exams, online exams. So I just reminded for you. Also, I send this information for you as well through my class message. Just keep that in your mind. Do not spend any time for the 2 case study preparation yet. Maybe we're going to have a final exams run in week 12. And percentage of the final exam, if they're going to run, will be same percentage and presented in the blackboard. When the final decisions comes out, I'll inform you through my classmates. And second point is, we did not discuss it, but here I have to mention it. Anybody have trouble understanding difference between warm, heat, some heat, toxic, and fire? This you learned from the diagnosis pathology. So warm is less heat than heat. Heat is more warmer than warm, yes? And summer heat is specific season related. And warmer heat could come any season. Toxic can come any season. And fire is more heat than heat. And fire is extremely heat than heat and warmth. Toxic, usually some have localized abnormal swollen and inflammations and growth with heat. And also we discussed basic concept of Wenbing. So what is a Wenbing? Wenbing is a kind of warm pathogen cause of illness, as fever present as dominant clinical manifestations. And also mentioned 7 classification of Wenbing. So wind worms happen in any season, specific in in the spring and the winter. Spring worms specific happen in the spring, and summer heat worms specific happen in summer, and damp worms mainly happen in later summer, early autumn, and autumn dry worms happen in autumn, and the toxic worms happen in any season, but mainly in the hot seasons. And also we compared a little bit subgroup of category of Wenbings, such as the difference between warm, spring worms and the wind worms, the difference between the some heat worms and the damp worms, etc. And also we mentioned the etiologies, pathogenesis, and the Wenbing and the common pathway of the Wenbings, and discuss a little bit epidemic Qi, Li Qi, and lurking pathogens, and only mentioned a few of the Western infectious disease name. I'll give you more. And we mentioned a little bit what means Wenbing. Wen means the study of the worm disease, and development of worm disease. Development of study of worm disease, mentioned some scholars' names. So here I have a little bit of review here. Now, before we go through detailed review, because we have confused the TCM terms with Western illness, here's the question is, can a named Western medical disease be treated as CM differential diagnosis only? So here's an example. A patient has been diagnosed by Ramsay-Hunt syndromes, type 2, for 2 days. So when you check the internet, you know what it is. And how can we apply TCM series without to explain this condition without knowing the clinical manifestations? We have to ask what kind of suffering you have, yes? So basically, TCM is based on syndrome differential diagnosis. We have to know the symptoms and the signs. We are not based on the name of illness diagnosis, because without knowing the clinical manifestations of this, you don't know how to treat. But if it tells you this is a kind of shingles, more severe kind of shingles, you know what would clinical manifestations involve. They blisters go through, yeah, blister like the rashes, horrible aching and pain, something else. So you know that. So just to remind you again and again, TCM goes through syndrome diagnosis. No matter what kind of medical illness mentioned, we have to know their clinical manifestations. By look at this kind of presentations, we know it's what? It's a shingles, it's herpes virus then, yes? We do not necessarily know the illness, but we still can treat it. But to know the Western diagnosis illness, we can understand better prognosis. So that's important to know both clinical manifestations, to treat it based on TCM theory, and to know Western illness to understanding and predict possible prognosis. We know what it is. It is still herpes virus, but it's chickenpox. They have different prognosis and different clinical treatment based on clinical symptoms. And we all know what it is. If we have children had measles, has happening, in the year when the state was. We know this one. We cannot scratch, more scratch causing more troubles, cross infections. We also know how to look after them if we know what clinical manifestations involved, what kind of Western illness diagnosis involved, and we know it's wind, toxic heat, worms, and then we apply proper treatment or proper dietary advice accordingly. Butterfly rash. So if we don't know Western disease name, we don't know basic prognosis. We only can base on clinical appearances and apply some relevant and herbal or acupuncture treatment accordingly. But if we know the name of the illness, we know it's not very easy to cure, but we could manage symptoms. And this is typical toxic heat and nutritive and blood level. We can use herbs to cool the blood and help to clear the toxic heat, manage the itchiness or sufferings of rashes. We all see this one, and since the COVID-19 happening, and this is a kind of excessive overreactive autoimmune system after COVID-19 virus affected the sensitive child, resulting in the 川崎症 or Kawasaki disease in children. So by looking at the conditions, we know this is wind heat, yes, but this one is heat in the bloodstream, nutritive level, yeah. And for this, we know it's horrible water. Wind toxic heat present on skin, still same illness caused by COVID-19 virus, causing excessive autoimmune system overreactions. This is very bad fuse of rashes, so heat in both Qi and nutritive level, very severe heat develops so quickly. But look at the color of his lips, you know the heat in the body is so bad, very high temperature. Look like a shade, a color of the ears, so red and very, very hot, poor child. But have a look this kind of tongue. There's a strawberry tongue color, strawberry tongue bodies, but they do not have strawberry color as red as a painted on top. Instead, it shows a lot of weakness on the spleen with this shining watery tongue body with multiple thorny and structures pointed out all over the tongue. This is due to capillary of the blood vessel had excessive heat bursted out, causing these kind of reactions. So this dryness on the lips shows a lot of heat, causes dryness in damage, but here shows a lot of underlying weakness in the spleen for the child. So this gives us lots of information from both conventional term and COVID-19 infections resulting Kawasaki disease for children in TCM. They have symptoms and signs, give us evidence to predict what kind of pathogens in TCM. Now, everybody should know, if this is not case study, it's final exam, they are going to have exactly the same percentage of what? Of overall grades, yes? So if any of you still have trouble, I'll read the details information in the blackboard. Here I have an example of common epidemic illness besides influenza, malaria, tuberculosis, and cholera, Ebola. There's also some very interesting terms, Lassa fever. And for Australia, I have Murray Valley encephalitis, Rose River, and worm fever viruses, hand virus infections, and these viruses. We live in Australia. If we don't go to the countryside, we don't know we have lots of nasty virus happening in the countryside, in the rural side, especially the region full of mosquito, full of the swamp, and do not do any camping in that areas. And one of my clients, after had camping 1 week in a very beautiful environment between Victoria and New South Wales, came home with horrible blister about 1 to 2 centimeter size in diameter, blister all over on her body. Her country dreams completely diminished after the horrible infection. And then that is from very, very bad virus. She told me all the local people knows they have that kind of horrible virus in the region during the summer from the mosquito bites transmissions. But because she's outsider. She did not do proper research first. That's why she had very, very bad virus infections from the mosquito bites. So mosquito sucking the blood from her skin and sharing nasty virus to her, causing very, very bad infection later on. So if anybody choose this kind of topic, that'll be very interesting for literature review and try to understanding our living geographic conditions or environment. So this information I'll send it to you. This is basically details discussing difference between warm fire, summer heat, and toxic heat. And here's a specific summary of development of Wen beings. And this very simple one, we can read it through. And this just try to basically review the Wu Yuke's special contributions for the epidemic article written. The first one, first the treaty of epidemic study found around the world, in the world. So this is the most earliest one recording about discussing epidemic illness. Ye tends to have great contribution for 4-level identifications in Wenbing. And he has been as co-founder of the school of the Wenbing study. Shares by specific contribution for damp heat discussion in the Wenbing. And the Wu Jitong is great to focus on specific about dampness, warm, differential diagnosis from his books, and also very good to focus on the triple differential diagnosis and the damp warm illness treatment from his formulas. Same for the Wang Mongying, they all have great contribution. They have living actually similar era. So 1808, this is about 1836, about similar era. They come from the same region of China along the Yangtze rivers. They all quite come from hometown, I think, as well. So here, we just go through a bit quickly. Wenbing is external warm heat passing cause of illness, as mainly reflected in a 4-level transmitted illness. And they're very quick transmissions. Their fever dominant conditions achieve clinical manifestations. And they have 7 categories involved: wind worms, spring worms, summer worms, and damp worms, lurking summer heat worms, autumn dry worms, and warm toxic things involved. So based on season, some based on pathogenic Qi, some based on combination season as pathogens, some based on clinical manifestations, some based on specific locations, or with damp or without damp. Here is a list of name of the Western disease you can choose that from. So wind worms could be represented in the infectious disease or influenzas, pneumonia or acute bronchitis. Spring worms usually represent in more severe influenza or epidemic cerebrospinal meningitis. Summer heat worms could be presented in conventional terms such as acute infections and causing very bad troubles for the brain. Usually when children have this, you should have something like suffering the mental disorder. They are not very intelligent in a way. They're very, very slow in the brain. So summer heat worms, part of that like this. But some people choosing summer heat stroke and severe summer heat stroke under the category of summer heat worm. You still could use that one as well. But this is a very complicated illness if you can choose this one. I can't pronounce it. That's why I put Chinese character ahead. And damp worms covered a lot. So typhoid fevers is quite a typical one. Salmonella disease related very serious infections, and even still some very, very bad influenzas related with food poisoning, something involved with and gastro related with influenza related conditions. So some influenza do not affect the upper respiratory system, instead causing people have horrible diarrhea, nausea, vomiting. So this could be in the category of damp worms categories. Later summer heat could have some severe influenza and could have leptospirosis. So you can pick whatever you prefer to deal with. Some damp heat worms, you can choose hepatitis. not necessarily using all the list here. You can choose temp hepatitis presented with combination damp heat. Make sure you're choosing either damp dominated or heat dominated. So no matter what the illness, you have to pick proper clinical manifestations. Now, any questions here? Gastritis in general, if they not have typical fever involved, you can choose in gastritis if you have fever. You have to have a fever involved or heat. Yes, gastritis. They're not necessarily contagious, but fever or fever involved, something you can choose gastritis. Usually much more severe one. If it's simple gastritis, just resting, fasting for 3 days, they'll resolve by itself. So this gastritis, if they can be called as Wen Bing, has to be treated by doctors. Thank you. Okay, there's more details of other Western illness names. So influenza, measles, rubella, German measles, mumps, epidemic, and parotitis, and epidemic cephalitis, epidemic hemorrhagic fever. This is a very scary one, and dengue fevers, and hepatitis, and thyroid fevers, and etc. There's so many. I even put a COVID-19 if you want it. So this I'll send it for you as well. Same for the acute tonsillitis can be used, or acute bronchitis, malaria and pneumonia, or can be used, or scarlet fevers. So a lot of choices. You can have a try. Even you can choose things you like as well. And once they can be matched into the 7 category in Wen Bing. This information will be sent it and after class. So this, we already learned this one. Basic pathogens relate to basic 7 category. They are involved. Nothing complicated. Any question for this part? Okay. Now, pathogens of Wen Bing: factors, constitution, environment, social conditions, social economic conditions, types of illness based on external syndromes or not, or based on it's caused by newly or lurking pathogens. So type of illness present differently clinically. And root of pathogens in the Shanghai focus on Taiyang divisions. For the Wen Bing, here focus on lung systems, which include the nose, mouth, and the stomachs. And for this one is enter into mouth and nose. So that's why upper respiratory system, digestive system can be affected straight away. That's the difference between Shanghai and the Wen Bing. So we compare, we know. Clinical attribution for the warm pathogen illness. So usually you have fever, quick onset, and quick transmissions. So quick onset, fever, and later stage you have lingering fever and correlated with immune damage due to hot nature pathogens. And heat is young in nature that can causing bleeding because the invigorated blood circulations causing very bad and measles-like very bad skin eruptions or bleeding-like conditions. Due to heat is very aggressive, they can cause very severe transmissions, causing pericardium affected and become unconsciousness. And this can result congestion, congealed flame fluid, and very easy to causing unconscious because these kind of congested pathogen miss the mind. Heat can generate inner wind, result in convulsion. So spasm, convulsion, tremor, usually correlated with high temperature in children. Heat can cause injury or damage the body fluid and yin. So thirsty, dryness, chronic complaint, or dehydration is quite a severe conditions correlated with high temperatures. So these are common terms from the pathology learned long time ago. And the remaining simple gaps, I'll leave you to fill it in by yourself if you want it. If you don't want it, fine, still okay. But it's good exercise in case some multiple choice related with these kind of questions and help you review and the concept we discuss in the class. So you can just fill these kind of little gentle cups in your spare times. So such as comparisons between this kind of pattern. So previous comparison between spring worms and wind worms. So try to understand different clinical manifestations, different etiologies, and different progressions. Same comparison between summer heat worms, damp heat worms, lurking summer heat worms, and to try have very good understanding and regard to this kind of the different etiologies, clinical manifestation, and seasons. Thanks for sharing. And there's also comparison between Wendu and Li Qi, so you can fill these kind of gaps. So what we're going to do for the remaining part, remember I sent you slides about the tongue. Anybody remember that? There's a lot of tongue image has been sent out. Now, just before we go through detailed studies, let's have a look some basic concept regarding to Wenbing, because compared with Shanghan and Wenbing, Shanghan, they all have very good formula correlate with different subject. Shanghan focus more on the pose, and the Wenbing focus more on the skin observations and the tongue diagnosis. So tongue diagnosis are very essential for the Wenbing study, and tongue diagnosis will be very important for you for the clinical practice, as well as for you if you're going to practice telehealth in your future practice. So go through online consultation in the practice. So let's have a look. The first slide. All right, it's a discussion time. You can have your say. Which one reminds you is possible linked to Wenbing and why? Number two, okay. Number two, okay. How we are going to interpret what second tongue. So what that tells you, heat, damp heat, wonderful. So they have both heat and the damp. So we call it damp heat, yeah. So for this kind of tongue, we call it damp heat. How do you call that kind of very funny distribution of redness? Is it normal redness or is something differently? Can you see this kind of the tongue coating, which are not evenly covered for the whole tongue? Yes, some part of tongue body does not have sufficient tongue coating. So this kind of redness pointed out or presented out of the tongue coating tells you they have very severe trapped of heat. They can become lurking heat or congested heat. If this heat cannot be resolved on time, they can cause serious and embedded heat, causing much more trouble later on. This tongue could be represented for people in acute stage of hepatitis or any kind of Wenbing, but basically they have both damp and heat are dominated simultaneously, because tongue coating color is a light yellowish, very greasy, but not evenly distributed. Remember last term in the clinical collaborating, if the tongue coating is not evenly distributed, what that indicated? No matter we were there or not, here we just learned together. If we have not symmetric tongue coating distributed on the tongue, could be possibly linked to what? To the liver qi stagnation. So you do not have evenly distributed or functioning circular liver qi. So this kind of tongue coating indicated body have congested liver qi on top of damp heat retention. Doesn't matter if we forgot it, we just review that together. Because when you're checking the tongue from the left side to right side, does the left side tongue coating equally with right side? Or here you can see something's missing. We all can see that, yes? And also you can see right side of the tongue a little bit bigger than the left side. This correlate with the gallbladder, large intestine, and the lung does not have proper descending, does not have healthy descending energies. So lung qi is not able to descending properly, which corresponds with The bowel movement is not sufficient to completely empty the rubbish, and gallbladder does not have sufficient secretion to supporting the digestion to break down fatty and heavy food. So for the tongue presentation, the second tongue in these slides is most acute severe conditions compared with other two, and dominant by both heat and damp pathogens. So they're both damp heat retention. And from the tongue structure, presentations, tongue coating distributions, we know they are not just damp heat retentions, also have noticeable liver qi stagnation, especially also correlated besides the middle gel. They also have a insufficient descending energy qi represented in the lung, represented in the large intestines, and the gallbladder stomachs. If you do not like it, very easy. Just imagine you did not hear about that. Let's have a look at first tongue. First tongue is artificial tongue because you can see the setting in the ceramic supporting jar. Third tongue is a real tongue. Third tongue patient is at the end stage of terminal illness. So if you see the number third tongue, you know there's no spirit. There's no qi because no tongue coating. That's why it's no stomach qi. They're going to die very, very soon. No spirit because there's no vitality. You can see the complete no vitality, look like dead of peace there. They're going to die very soon. So we don't have a chance to do any kind of prognosis for that one. And also number third tongue, you can see right side much more protrusion than left side. They have no proper muscle tones on the tongue at all. No qi at all. The whole hard qi has diminished. And it is at the end of the stage. I hope the person had very peaceful journey to go to the death. It's part of our life, go to the death. Now, number one image tells us what? If this represented in Wen Bing, number one image tells what? Wonderful. It is yin damage. We can see multiple cracks. So it's an early stage of Wen Bing or later stage of Wen Bing tongue. Later. So this first tongue, thank you very much. Usually, and with multiple cracks, you can see this typical yin has been damaged. If this represents in Wen Bing suffering, usually is in later stage. Heat has been very well managed. Only remaining injury of the body fluid from the previous existence of heat. But with tongue coating, you can see still have some grayish yellow tongue coating, but they're relatively dry, not greasy. Compared with second image, tongue coating is more greasy, but the first tongue coating is not greasy at all. It's dry. So like a moss, usually growing in a very damp, cold environment or damp, warm environment. When the sun is so hot and dry, this MOSS is going to completely diminish. Yes. Same for this tongue coating. It's going to clean up very quickly. So most important, we need rehydrate the bodies to restore the proper stomach qi. They still have stomach qi. That's why they still have tongue coating. Yes. They still have pink color. They still have vitality. Still have a spirit. They still have reasonable shape. They still have essence. So I forgot to charge. So that means this is still can be treated and still treatable. Now, any question for this one? Can you still see the left side of the right side of the tongue is larger than left side? Okay. For the person is the right side. For us, it looks like left side image. So the right side of the tongue is larger than left side. Yes? So which tells you quite common for human beings. Yes, they still have congestion, liver qi stagnation presenting. At the same time, they have not restored proper balance for the qi in the lung, in the gallbladder and the intestine. So monitor the bowel movement, monitor the digestions, and monitor the color of the stool to see the gallbladder secretion activities. That's all for today for the contents we are going to discuss. That means every week we are going to discuss 3 images, 1 slice of the tongue for 3 images of the tongue to consolidate tongue diagnosis, to link it with Wenbing. We're leaving 15 minutes or leaving some times for question times. So I'm going to show that in a whiteboard. You can put anything you're interested to have a bit chat. Whiteboard. So there is a question, sorry, that's the last question, I did not get it. How come this tongue 1 shows gallbladder issues? Okay, tongue 1 does not show gallbladder issues, a serious one. And with the size of the right side of the tongue is bigger than left side, here tells you descending qi in the gallbladder, lung, and large intestine has not been restored to the proper size yet, because they just recovered from what? Womb disease, if. Why the gallbladder? Because the gallbladder is correlated with stomach's qi to descending and help the digestions. And if you have very healthy gallbladder, usually not very easy for you to suffering digestion issues. For the tongue coating distributed in the image 1, still shows they do not have healthy digestion. The tongue coating in image 1 shows a little bit dry and grayish. Why larger when not descending? Okay, I thought we discussed in the Collaborate in the Classics, in the clinic last term, but here we just elaborated. Okay, now I'm going to make a drawing for the beautiful tongue. Now, for our overall energies, left side energies descending or right side energy descending? The tongue for microsystem, tongue tip corresponds to the organ of what? Heart. Good. Heart is located on the top or bottom of the body? Top. Wonderful. So this is a top. Here's a top. That means here's a bottom. Okay. So based on the qi circulation of bodies, left side of the qi is going to what? To ascending. Right side of the qi is descending. So this will answer the questions. When the right side is swollen, oh, sorry, I'm going to change color. When the right side is swollen on the tongue, that tells you corresponding of organ and the qi dynamics have some troubles. So what organs have descending energy qi? The lung have descending energy qi. Large intestines, coupling organs or channel have descending energy qi because we have poo every day. If large intestine qi descending up, we are going to have what? Regurgitated poo. So that'll be different. Stomach qi descending, lung descending, large intestine descending, and gallbladder also correlated with stomach descending. Wonderful. So descending qis involved gallbladder with large intestines, lung with lung with large intestine, gallbladder with stomachs. Not the question marks. It's a slash, forward slash. So gallbladder, stomachs, they're all descending and they maintain good digestions. Lung and the large intestine have to be descending and which balance with the qi ascending from the spleen and the liver. Does that help you, Cassandra, about the qi dynamics in the body? Yeah, okay, thank you. So that's quite common, very high percentage of people, when they have organ imbalance, they have a swollen tongue on the right-hand side. So checking your tongue in front of the mirror, have it fun. If your tongue shows quite swollen, most important, checking the poo first. Quantity, frequency of the poo, color, and smell of the poo. Any of the abnormalities happen on the poo, you need to checking your digestion stomachs and gallbladder. At the same time, checking your capacity of lung, especially the descending qi of your lung. Thank you. All right. Now, any other questions besides why this right side of the tongue swallowing indicated descending qi is weak? So here, give the answer. Any other concern? Same size of ascending, descending of the tongue for both male. Same for the genders. Yes, thanks, Jacoba. Same for gender. Yeah, it's not discrimination involved now here. Thank you. So if we have not attended any clinical collaborating last term, you're not going missing anything. We are going to consolidate this through this subject again by adapt using one being discussion and tongue diagnosis. So hopefully everybody can very good share. If we learn, consolidating review. If we haven't, and it's good introductions. How about right side tongue larger? Same thing. If they're swollen or larger, that all means abnormalities correlate with qi dynamics in the level. But if we do have a tongue, okay, I'll clean up this one first. If we do have a tongue, are not very good symmetric, so looks like right side much more larger instead of swollen than left side, still indicate some obstruct. This is abnormal, quite common, unless you have noticeable liver yin or liver blood deficiency. They could happen very thin, weak on the left side, as well as very bad hollow sunks at the edge. These will present on both sides. Like the shape of this will happen on the side of the tongue. So if we check the tongue in the side way, the tongue looks like this. And because we mentioned the qi dynamics for liver is what? Is go where? Which directions? Go upwards. So liver's qi is expanding. When liver blood is deficiency, liver's qi is not able to expanding, not able to nourish. So it's much more easy to show, if we really want from theoretically to show the thinner on the left side. But usually both of these sides working very dehydrated, very thin and poor constructed. Okay, any more questions? And they still have questions. Why the gallbladder, stomach, lung, and liver on the right-hand side? Okay, for the basic qi dynamics, sorry. Okay, we're assuming this is symmetrical tongue. There's the middle. We know the qi using microsystems. Left side of qi have to be descending. Right side qi have to be left side qi have to be ascending. Right side qi have to be ascending to forming complete cycle of our channel and our yin yang theories, to forming very good loop of the fish loops. Yes. If these circles have any kind of obstruction, we don't have proper yin yang to be nourished. So based on theory of Qi dynamics or based on channel theories, you can find all the gallbladder, stomach, lung, and the large intestine channels. When you raise both of your arms up, they're all descending downwards. All rest of other channels corresponding to this one are ascending upwards. So spleen, gallbladder goes upwards. Does that answer your question, Michelle? Okay, thank you. So with the, I saw the gallbladder went down. Gallbladder went down, yes, here is a down. Down ends on bottom of the tongue. Here is a down, here is up. On microsystem, tongue tip is up of the body. On root is the bottom of body. Thank you. So gallbladder goes down. That's why the arrow here goes down. Sorry, we should put the tongue upside down, and then we won't get confused. I'm getting confused as well very easily. I'm sorry. If we draw tongue like this, so never get confused. So that means left side goes what? Goes up, right side goes down. Does that make sense? Yes? So this one is easier. So we go this, sorry. Oh my God. Left, oh my God. Goes up, right, go down. Does that make sense? So we don't get confused. Yes? So we reverse ourselves. Most of the tongue image, we can see the tip on the bottom and the root on the top. So very easy to get confused for this one. Okay. So no question for today's concept. We'll all focus on the tongue. Now, anything else before? Could you explain the tongue, the sideways drawing indent? Okay. When okay. When you don't have enough blood, imagine this is a balloon. Yeah, the tongue present like a balloon like this. I'm going to clean this. It's so messy. It's better. If the tongue presentation can be used as a shape of balloon, if you put enough air inside, tongue will show very good structure shape, yes? But if only give them half, like the blood, only give them half, you can find when it's squeezing the edge of the tongue, you can see what? Dent. Basically, it's dent. You'll see the dent, Charlie. You'll see the dent on the edge of the tongue. If you have very severe blood deficiency, you will see dent here. It's better using the term of dent. Yes, both sides could all be dented in or sinking in or sunken, yes. How does the flow start from left? I didn't say to start from left. You can start from right. Doesn't matter. They actually is a continuously non-stop flow. Or you mean why they start flowing like this? Yes. Left and right, left and right, because the left side is ascending, right side is descending. That's why based on TCM series, you go this one. So imagine you standing in face the sun. Your left side is east, and you can see basically the sun from the left on top of it go to the right side of the hands. So always goes through these directions. Does that answer the questions? You're standing facing the sun. A person standing facing the sun. This horrible person standing facing the sun. The left side is facing east. Oh, sorry, yeah, facing east. And then you draw the path of the sun. Sun's from what? From left go to right. So same for these kind of circles. You have to facing sun. Doesn't matter north or south. Depends in different hemisphere. You have to facing sun. Yes. Facing the sunlight. Yes. These will never change if you're facing sunlight. Okay, any question for today's concept besides of tongue? You got it? Okay. So no matter which hemisphere we live, when we're facing the sun ray, left hand side touch to the east, and the right hand always can draw the circle from left to right. Yes. So this one will never get confused. But if facing the south, like you're living in the other side of the earth, it's very easy to get confused. Good. Regarding to lurking pathogen, which levels do they lurking? That's good. I like that questions. I don't have very good image of a tongue yet. Have a look with a big drawing. All right. When we were not sick, but we can see numerous horrible dots on our tongue, you're a bit scared because what's that? Is that going to bleeding? Especially they have no symptoms but does not look normal. You're a bit wondered after you learn TCM, especially after learn diagnosis. Oh, my tongue looks very funny with lots of these kind of dots. So which level they are actually trapped in? They call that trapped in the collateral. So this could be explained as a superficial, could be explained as internally. Depends what kind of clinical manifestations when triggered out by another cycle of outbreak of illness. I know these are weird answers, but if that help you, and I'll be happy for that one, Nikki. Does it help you, Nikki? They're trapped in collateral. If from any external trigger pathogens causing another outbreak, during that outbreak, clinical manifestation, present symptoms will indicate where they will be troubled. Otherwise, we don't know where they were trapped. They're basically trapped in collateral. In other way, trapped in the bloodstreams. We know that. In the collaterals, it is in the capillaries, yes. So collateral is much more accurate indicated locations. There could be any kind of levels, depends your constitution, depends the trigger points, bring out another outbreak. Okay, now that's all for today. And if everybody's okay, and thank you very much. We're going to see you next week. If you still have any concern, I'll wait for 5 minutes to answer individual private concern. I'm stopping recording now. Thank you.